The decision that I have to make right now is that when I want to have my knees replaced. The reason for that is pain occurs almost all the time. When I get up in the morning, as this morning, we have a 2-story house. So I'm upstairs, I go downstairs, I can tell right away whether I'm going to have a good knee day or a bad knee day.
Because people are living with some of the medical conditions that the decision aids relate to, those are the conditions I use mostly. Osteoarthritis of the hip and the knee. Those are chronic conditions that people will be living with the rest of their life. So over that time, you've pondered having knee replacement or exploring other treatment options. And you had a chance to review the decision aid that I gave you at our last visit.
Right.
Did that help you reach a decision? Has it helped bring out or emphasize what's important to you in making your decision?
Well, yeah, it's over the years I've known that I was going to probably need to have it replaced.
These decision aids are so well structured that they have very good non-biased information that don't lead anybody down a certain decision. They don't make the decision for them. They put it all out there and allow the patient to decide for themselves what options they may want to pursue.
The doctors that I'm working with right now have not told me what to do. They have asked me what I wanted to do and if and when I wanted to do it.
So your big concern was actually the process of having the surgery, the recovery, and the trauma of the surgery itself, and not having to go through that twice.
Right.
By doing it too early was a
Right.
big part of your concern. So as long as you felt you could do the things you enjoyed doing and get along with the pain,
Right.
Your thought process sounds like your option was to hold off as long as you possibly could.
Correct. Personally, if I did not have to have the surgery, I would rather not have the surgery. But because I've gone through the many years of the pain and done everything that they told me to do, I know that it's not going to get any better. I'd like to delay it even further, but I just don't think it's going to happen. I mean, I could get by for a few more years, but I don't want to. Today, if I do not make a decision, and reading and looking at the videos that were provided to me, that it's not going to get any better, and I keep taking pain medicine, and I know that's not good for me. So I've just decided that talking with Dr. Steinmetz and asking some of his advice, possibly what I should do, I've just made the decision to get it done.
I always try to approach my practice of medicine as being an advisor and consultant and educator for my patients and helping them manage their decisions. Shared decision aids aren't for every patient as well. There are patients who still want that traditional authoritative role of a physician to just tell them what to do. I know one of the things that was important for you was, again, that trauma of surgery and the setback and the recovery. So that may really bring out that simultaneous option for you when you meet with the surgeon.
Yeah, that's my biggest fear, that I'm going to be the 1% that something goes wrong. That's always in the back of my mind. My advice to anyone who is thinking about having their knees replaced, do they want to go through the pain all their life, or they want to get rid of the pain? And they have to answer that question.
And that's what empowers our patients to give them a better perception of their outcomes. They feel empowered that they made the best decision for them.